Hello, everyone, and welcome to our e-Lunch and Learn today. If you advance the slide, wanted to do quick introductions. My name is Jacqueline Kung, and I'm with, if we could go to the next slide, I'm with Activated Insights, which is the senior care group of Great Place to Work. And today we have a really special panel in Chris Hollister, who was the founder and CEO of Southern Assisted Living before he founded Pegasus Senior Living with about 36 communities. And we also have the co-founder and chief medical officer of CareAcademy, Madhuri Reddy, on today. So we wanted to convene this webinar to share what we've found across all of senior care, as well as dive into best practices of different providers. So let's get going. If we go to the next slide, just in terms of the question always comes up, yes, you will get a recording of this Lunch and Learn afterwards. And also, if you have any questions anytime, please put them into the chat box. We are monitoring it and have about 10 minutes at the end of this 30-minute session to answer questions. All right, so in terms of the context, we have at Activated Insights, for the last month, we've been surveying both senior care providers as well as frontline employees about what their needs are, as well as what's working and what's not. In terms of what the frontline employees are saying, it's a surprise that, with all the mass layoffs across the economy, there's actually more of our frontline employees feeling the financial hardship. 40%, and it's actually increasing by the week, is saying that they are hitting a financial hardship because of COVID-19. It's between family members being laid off and having more mouths to feed at home and needing to stock up on items. A lot of folks are saying that they are the only breadwinner in their household now. And of course, 2/3 of senior care employees across our industry care for a child or elderly loved one, and about 1/3 are struggling with childcare. And half or more are saying that they are struggling with getting daily necessities, such as toilet paper, milk, eggs, and bread. Those are the most frequently mentioned necessities, in addition to PPE, masks, gloves, and cleaning supplies and sanitizer. What's also interesting we wanted to highlight is about 1 out of 5 are that have a lot of unknowns, and this may highlight some of the things that you could communicate, which is people are wondering about PTO. They are wondering, what will happen to their jobs. So clear communication is really important at this time. And in fact, if we go to the next slide, just to share some of the best practices from across providers, if we could go to the, before we go to that, I've mentioned that we have been surveying frontline staff. If you would like to hear from your staff, we wanted to offer complimentary feedback for any organization attending this webinar. So if you are a senior care provider, whether you work with us or not, we want to help. And by this time next week, you could have feedback from your staff. We can share what questions others have used that you could use, or if you have questions that you want or need answered from your staff, we have a way to do that in mass with the 6 feet distancing and everything. So a lot of providers have been doing this. We have a couple thousand surveys coming up this next week, and happy to add you to that and get you feedback from your staff. To do that, just send me a note. My email is here. It's jkung@activatedinsights.com, and I can get you matched to a program manager to get you all set up today, tomorrow, and then you can, by this time next week, have the feedback. If we go to the next slide, we wanted to also share some best practices across providers that we're hearing. For those hardships that frontline staff are expressing, some providers are making bagged lunches for employees to take home to feed their kids, or offering discounts on food or meals, as well as supplies. If you look on the right side of this page, essential for healthcare workers, this is what Kaiser actually put up for their staff last Friday. And they are, as you can see, they're selling things like toilet paper, milk, eggs. This is a very common problem that people are having trouble finding, or that they don't want to go store to store to store to store, exposing themselves. And so we share this as an example of what Kaiser is charging. In addition, for the childcare needs, providers are for the first time ever offering childcare stipends, different amounts, they're doing it different ways, or childcare cooperatives within their employees or local daycare centers. And then for the PPE side, we're hearing lots of CEOs of even large and medium organizations across senior care who are on WeChat with Asian suppliers at night, figuring out customs and getting masks to their staff. That's working, and we need more. Some of the best practices in terms of lifting spirits include some providers offering virtual meditation at the beginning of each shift for employees, or virtual, text message or email quotes or inspiring vignettes. Great Place to Work works across industries, of course. 10 years ago, when we had the Great Recession of 2008, 2009, Edward Jones actually shared that they sent out 64 employee communications in a month just to keep folks posted on what was going on. If you think you're over communicating, you're not. Lots of communication in these times of uncertainty is key. Lastly, some providers to lift spirits are playing music, especially in senior living and nursing homes, and singing at work. And then drive-by happy hours are helping very much for our seniors, as well as lifting for the moods for people who are bringing snacks to different seniors. So that's across providers, across senior care, senior living, and at-home care. But we thought it would be really great to highlight one of the leaders in this area, which is Pegasus Senior Living. And I'm going to hand it over to Chris to share what they've done to prevent COVID from coming into buildings, and then also when there are active COVID cases, what have they done? So Chris?
Thank you, Jacqueline. Hello, everyone. Good morning, good afternoon, depending on where you are. I'm co-founder of Pegasus Senior Living. I've been in the sector since 1986 with different companies. We have 37 communities from the Pacific Northwest to Florida, mainly assisted living with some independent living, and about half our communities, or not quite half, have memory care components. Obviously a very challenging, stressful, scary time for all of us, and I applaud all of what all of you are doing. Your commitment to seniors and trying to get through this difficult time. I think the industry has done a lot of the similar things. We're shutting down dining, delivering meals, trying to make sure we have enough PPE on site, which has been pretty good about that. If any of you work with direct supply, they've been doing calls. Our Jenum and Asha have also been doing calls. There's other people doing webinars to get the information. I know direct supply has 30 people in China trying to source PPE. And I think we have maybe 2 or 3 more tough weeks, or just call it the May 1, but I do think that problem is a lot of people are working on it. We were lucky. We have an in-house physician, Dr. Sandy Peterson. We had a relationship with a lab where we were able to do testing, I think, before most people in the industry were doing it. We've been doing on-site screening and cleaning like everyone has. Obviously, on new admissions, we've tried to be extraordinarily careful, particularly in memory care, where you really cannot do social distancing. We're really not taking new memory care people right now. And even on assisted living, we've tried to be extremely judicious with anyone who has any sort of chest infection or UTI or any other problem that might be an indicator for COVID, or frankly, just people who are heavier care that we would normally take. But we don't want to overburden the team members right now by bringing in heavier, 2-person lift type people, even in assisted living, even if it has nothing to do with COVID. One of the unique things we did early on, I think, is we were ahead of most of our competitors on putting in significant hazard pay. I'd rather not say the amount, but instead of trying to do something with child care, because not everyone has a child and we're in such diverse markets, we just made a blanket hazard pay for all hourly employees, regardless of department, across the company. That has been incredibly well received by our team members. We've also given our executive directors carte blanche to tell us who they want to recognize with additional monetary stipends during the month. Each one has a monthly budget. And frankly, we've asked them to give us, we're calling it the Above and Beyond Award, and I spend my nights and weekends writing cards to team members. I found a on-site app called Felt, F-E-L-T. I don't have any investment in that company, just to mention the name, but it makes it very easy to send a personal card handwritten to someone for $4. You don't have to run to the mailbox or do any of that. So I'm doing that every day on the weekends to our team members, because these people really are heroes who are working. We've been fortunate of not had very many cases, and when we have had them, knock on wood, we've been very diligent about cleaning protocols and appear to have turned it back, at least in a couple of buildings. And there's groups out there. We work with Blue Team, who are very experienced senior living folks, to come in and do a very meets different protocols for how to do a deep cleaning, either in a wing or just a unit. It depends on the situation. They have been great to work with. I know ServPro is also doing the same thing. Block room assignments becomes very important. So if you do have a case, you can try to do social contact tracing to know where people have been in the building, who else they may have been touching in close contact with. We've also tried to encourage people, and in some states are mandating this, that they only work with one community as opposed to floating to different ones. And obviously agency is a challenge, and I don't have a magic bullet with it other than with the hazard pay. We've tried to decrease that, because folks that are on agency where they're going to 2 or 3 or 4 buildings is obviously scary right now. Media communication, and just as Jacqueline said, we've tried very hard to communicate with our website. I've done a video, and our VP of Sales and Marketing is sending several times a week updates out to our families and our residents as well. What's that?
Oh, I was saying,
Sorry.
if we could go to the next slide.
Yeah, okay, sure. And recovery stories, and we had a 92-year-old guy who got COVID, and he beat it, and he seems to be doing well. So, you know, we do have those out there, and again, we've been very lucky of having a limited number of cases so far. It is scary when you do get in a building, and it's kind of almost like the early days of HIV and AIDS, I think, when people get this, and people just, the fear factor goes through the roof. I don't have a magic bullet, but we just try to counsel people, make sure they're not stigmatized by it, and hopefully do testing and either verify it or get a negative, and then go forward as best we can. So, Jacqueline, those would be my thoughts. I'm happy to turn it back over to you.
Okay, wonderful, Chris. A quick follow-up question. Can you name that place online that sends cards again? Eli would like to know.
Sure, it's called Felt, F-E-L-T. It's I use the iPad and with Apple ecosystem, so you can download it from the Apple app store, and it's F-E-L-T.
Great, thanks. And Chris, can you talk about, can you name those deep cleaning places? Because there was a question around how do you deep clean after a live case?
Yeah, Blue Team is one of them, and they've been in the industry. I think they have 26 offices around the country, and we've been using them because we had a prior relationship with a colleague. ServPro is also doing this deep cleaning. We're also getting, I should have mentioned earlier, these electrostatic foggers that attach to the virus and kill it. And, you know, we have clusters of buildings in different places, and we can actually share one. I don't have the exact pricing on that, but that seems to be a very effective way to, particularly if it's just one room that you're trying to do or a hallway.
Awesome. Thank you, Chris. And so, of course, that was the senior living side. If you have any more questions, we can answer them later. But let's move on to the home care side of things, which Dr. Reddy, if you're ready to go.
So I am co-founder and chief medical officer at CareAcademy, and we educate direct care workers, primarily home care, home health, but we do direct care workers that work in facilities as well. A majority of questions that I've been getting regards to personal protective equipment, because, you know, our main goal, all of our main goals really, is to keep the older adults and families safe and to keep these very valuable caregivers, professional caregivers, safe as well. So I'm going to actually lead by going over the CDC's requirements at this time, or suggestions for masks. And let me say that it is an ongoing, changing situation, as you all know. I put up some links for you to go into more detail, and I recommend you look at them on a daily basis just to see if any of them have been updated. I believe all these links, a couple of them were last updated April 2nd, and a couple were last updated April 13th. So let me start by saying that if everybody had enough PPE for all these COVID patients, and again, everything that I'm getting and everything you all should be following as well should be coming from an official source such as CDC or the WHO, because there are so many rumors around that really have no basis. And so it's important to look at one or two people that are giving you or sites that are giving you correct information. So if we all had enough PPE, and we were seeing a COVID patient, we would wear the N95 mask, eye protection, gown, glove. But the situation is that there isn't enough PPE. So the CDC has three distinct situations that they posted on their site, and what to do in each situation. So the first situation is that there are plenty of face masks and N95 respirators. So as I said, that is not the situation right now. The second situation is there are no N95 masks and limited surgical masks, and that's really the majority of cases right now. Direct care workers should not need to wear an N95 mask when caring for clients with COVID-19 unless they're assisting with aerosolizing procedures such as vents or nebulizers, and there's a few others. So if supplies of surgical masks are limited and your agency does not have access to N95 masks, the CDC recommends extended use of face masks. So a direct care worker may need to use the same mask when caring for different care recipients, removing it after each encounter. Face masks with elastic ear hooks are more suitable for reuse than those with ties. And between uses, store the folded mask in a clean, reusable, sealable paper bag or breathable container. Prioritize face masks for selected activities, such as when splashes and sprays are more likely. The direct care worker should be instructed to stay at least 6 feet away from the client when possible, and to only come within close distance during absolutely mandatory activities. Also unlimited with masks, reserve the face masks for direct care workers who maybe have some risks, and also have clients who have respiratory symptoms or COVID-19 wear masks as well. Finally, there's been a lot of talk about homemade masks. And let me just say that those homemade masks are an absolute last case scenario, which I don't think should be the case for any of these home care workers right now. What the CDC has been recommending is that the public wear a homemade mask, but this is, again, not to protect yourself, but to protect the spread to other people. So I think that that's probably all my time. Jacqueline, the only other thing I would mention, I gave you all links, and the only other thing I'd mention, we were talking about cleaners, and you can go on the CDC site and there'll be a link to connect you with the EPA site, and that lists all the cleaners that are effective against COVID-19. So I wouldn't recommend using something that's not on that EPA site. So yeah, that's a quick summary.
Wonderful. Thanks, Dr. Reddy. We had an attendee, Bethany, asked, what do you think about breathable containers? Should we consider using those?
Paper bags. Paper bag is a good container, or something with, something, a Ziploc or something obviously wouldn't be breathable. I think there's so much subjectivity to all of these recommendations. And as long as you're following the posted guidelines on the CDC and you're able to, documentation is still so important, able to document your rationale and to show that you're doing the best in these circumstances, sometimes that's really the best you can do.
Great. And Dr. Reddy, can you also speak to, it's mixed bag in terms of whether if you have gotten COVID-19, if you can get it again. How do you consider that given, one of the allocation of staffing is to staff someone who's recovered from COVID with a client suspected with COVID? How do you consider that in lieu of, the uncertainty whether someone can get COVID again?
So we don't have a serology or blood test now to show if someone has immunity to COVID-19. Most of the medical thought around it is that you probably wouldn't get it again if you had it once. And so, in terms of appropriate staffing during limited circumstances, again, just take a look at one of the links I have, consider allocation of staffing, and CDC site for crisis alternate strategies. And they say on that, if there's a limited number of staff, you might consider people that have previously been COVID positive to take care of patients who are COVID positive.
Okay, wonderful. Thanks, Dr. Reddy. We have a question from Lacey on hazard pay. Chris, I know you didn't want to say how much you did on hazard pay, but can you talk around, how you guys considered hazard pay and elaborate on how you rolled that out?
Yes, sorry, I had it on mute. You know what? I wish I could tell you we did a big scientific study where we just sort of picked a number that seemed appropriate, and it was kind of, bigger than a bread box and smaller than a garage. We said, why don't we do that and send it out? And it's been very well received. It's for all hourly workers, regardless of what department they're in. And I don't really know how else to get into it without getting into the actual numbers. But
Chris,
sorry,
this is Jacqueline. I can share some. So in terms of hazard pay or extra pay, we've seen 3 types. One is a per hour increase, and the ranges that we're seeing are between $1.50 and $2.50 an hour across the board. The second type of pay increase that we're seeing are around kind of bonuses across the board. We're seeing a lot of kind of an extra day work. So whatever you're scheduled for and paid for, a bonus of an extra day of the week, which comes out to be about 15% more. And then the third is recognition or spot bonuses. So recognizing with some extra bonus pay, some people who go above and beyond on a case-by-case basis. And as Chris had mentioned, we're hearing a lot of providers doing it, meaning their ED is looking out, or some of the leadership teams, especially within communities, are looking out. And those are the 3 types of pay increases or pay bumps that we're seeing.
And just to clarify, we did it as an hourly rate increase, and I can certainly validate the range of what Jacqueline said.
Great. In addition to actual dollars, the thing that a lot of frontline staff are asking for seems to be access to supplies to take home, because they fear going to the grocery store or going to multiple grocery stores and exposing themselves. They really appreciate it. And some providers have, if you're ordering from Cisco food anyways, letting folks buy a carton of eggs. And when you get the recording, you can see what Kaiser posted up in terms of the prices that they're charging. Some providers are charging discounted prices, and some are charging, more rack rate prices, but really appreciate those types of things. And then the last thing I'll say is a lot of providers are providing appreciation beyond money or supplies. Notes that Chris mentioned are being written, candy bars, free lunches at work, that's a surprise free lunch. Very much appreciated. We just have one question left. So if you have any more questions, please type them in. But the one question that we have left is this is for both Dr. Reddy as well as Chris. In terms of staff who work at multiple providers, this happens a lot in the agency world, as well as staff who are fearful of being exposed to COVID-19. How do you deal with those situations of staffing in light of potential exposure and either fear of coming to work or how to staff to minimize the risk.
Chris, maybe I'll just go ahead first.
Sure.
So I will say that, first of all, that's a great question. And educating staff about what we know about COVID-19 and PPE is very important and really does, we found, help to alleviate many of the misconceptions and fears because of staff that may not want to go into work, et cetera. So actually, CareAcademy has a very frequently updated COVID-19 class that's free to anybody, not just our customers, and also a masks and PPE class. So you're welcome to check that out. So in terms of going to different facilities, absolutely. If somebody has symptoms, respiratory symptoms, or is waiting on a COVID-19 test, again, check the CDC site, because in most cases they will have to self-isolate for 14 days and they can't go to other homes or institutions during that period of time.
I would just say in California and Washington, and I believe maybe a few other places, we're really just asking people to pick, to say, look, you either got to stay with us or go with your other one. Now, it's hard to enforce. You don't really know 100%, but we're asking that. In terms of when you have cases, there is a fear factor, obviously. We try to do everything Dr. Reddy said in terms of educating people. And we do have plenty of PPE. I think it's extraordinarily more difficult in the assisted living and senior living if you do not have PPE for people. But so far, we have been able to stay really fully stocked with material. But at the end of the day, it gets into an HR issue without getting into the whole decision tree. But if people absolutely refuse to work and call off and don't show, at some point it has to be considered job abandonment, not to be mean-spirited about it, but you do just have to get it into an HR issue with it on a case-by-case basis.
Great. Thank you, Chris, and thank you, Dr. Reddy. We don't have any more questions, and we have promised to keep this lunch and learn to 30 minutes or less, and we're on target for that. So big thanks to everyone for the hard work out there and to your teams. Hopefully this was helpful. If you would like any more lunch and learn webinars, please make a comment when you do the review on this. This is changing every day, as Dr. Reddy mentioned, and so our goal here was to share the best practices as of today. Thank you, everyone.
Thank you.
Thank you, everyone.